Look, can you give me your assessment thus far of how the vaccine rollout has been proceeding stateside?
Sure. I think it's been proceeding pretty well. I think coming out of the FDA advisory committee meetings and authorization, people have a pretty good sense of what the vaccine is. We're seeing a lot of vaccination at hospitals and now increasingly at nursing homes around the country without any real surprises or a few allergic reactions that are not entirely are not surprising, really. But really no major problems, and people still really excited to get the vaccine within healthcare and increasingly at nursing homes. But I do think it's going to get more difficult very soon.
Why?
Because once we go beyond the places where the distribution system is built in, like a hospital can turn around and vaccinate its staff and hopefully some of the community health providers nearby, or a nursing home where there's a partnership with pharmacies to go to the nursing home. There are only so many nursing homes. It's a lot harder to figure out where to vaccinate, how to find people who are at the highest risk. For example, older adults live in homes, they live in assisted living, they live in senior housing, and as you get into essential frontline workers, they live everywhere. How to actually set up vaccination in a way that they feel comfortable going, that they can really access despite, working full-time jobs. All that requires a very strong public health system, and we just got the funding yesterday for vaccine distribution in this country. So I think there are going to be hiccups around the country.
Okay, so let's talk about some of the limitations and some of the opportunities here. I want to talk about the opportunities first of all. As you say, with the Pfizer-BioNTech vaccine, and to a certain extent with all RNA vaccines, and I'm talking mainly about the Moderna one here, there is a temperature stability transportation factor which you've got to bear in mind, which makes it much easier to deliver from kind of centralized nodes. We are waiting now. We could potentially get clearance this week for the AstraZeneca vaccine here in the United Kingdom, and we're looking for the J&J vaccine clearance fairly early on next year. The J&J vaccine is a single shot, which obviously reduces friction, and it's alongside with the Astra vaccine can be stored at much higher temperatures to maintain stability. You can keep them in the fridge, basically. How big a shift is that going to provide in terms of this vaccine rollout process?
Well, I think authorization of more vaccines is going to help, first of all, for supply, because there'll just be more vaccine around. Second of all, because as you point out, they're easier to move around, and they can go in smaller groups. Like the Pfizer requires this huge batch to be defrosted at the same time, which is hard for a small clinic to handle, for example. But I do think it's still going to leave the actual mechanics of setting up vaccine clinics, figuring out where to put the vaccine, going to try to reach hard-to-reach communities. So I think it's going to help with part of the problem, but not the whole problem. I think we're going to have to see the investment in the public health system really pay off, and public health departments, despite a really brutal year last year, turn around and figure out a way to push vaccine to communities that really need it.
Let's talk about staffing and also the interaction between what is happening on the ground at the moment with the surge in the case counts that we're seeing around the world, and also kind of the staffing to be able to deliver the vaccine. Is it a zero-sum game? Is it that if we are dealing with more virus cases, we have less resources to vaccinate people? Is it a zero-sum game when it comes to staffing on that count?
Well, certainly it is in a lot of places. I mean, it may not be perfectly a zero-sum game, but there's a lot of competition. The healthcare system really does step in to lend a hand to public health when you have major projects like vaccination, but the healthcare system is spilling over, as it is in some parts of our country right now. Then they really can't do that. And similarly, the public health system tries to help out the healthcare system, through planning, through messaging, through testing, all these different things. It's the same staff. There's no extra staff for vaccination. They've all been pulled to help with the response. So I think it is going to slow down vaccination in those places that are overwhelmed.